I have breast cancer, and my doctor recommended a sentinel lymph node biopsy. How is this procedure done? And how many lymph nodes will be removed?
When there's a diagnosis of breast cancer, it is very important to determine the status of the armpit lymph nodes. And this is because we want to know if the disease is all contained to the breast or it has traveled through the lymphatic system trying to escape from the primary site, which is the breast. In order for us to properly assess the status of these lymph nodes in the armpit and to know has the disease traveled there or not, we perform this so-called sentinel lymph node biopsy. For this particular surgery to be possible and performed, you need to receive a couple of injections before of your surgery. It depends on who is your surgeon and what technique they are more acquainted with and more comfortable. They are going to be recommending either one of the two or a combination of those two injections. One is it's a radioactive substance that is injected in your breast, and that travels through the lymphatic system that leads to the lymph nodal chain. The main station of lymph nodes, so the main lymph nodes draining from the breast, will capture this particular radioactive substance, and your surgeon will be able to pinpoint which is the area that is capturing that radioactivity in order to know which lymph node to remove, because they all basically look the same when you open the incision. The other injection that can also be used in combination or not with this radioactive substance is called blue dye. And this injection you receive at the day of your surgery once you are under general anesthesia. The reason why this is given when you're under anesthesia is that this takes much less of a time to reach the main lymph nodes in the armpit. Whatever is blue and or radioactive needs to be removed as sentinel lymph nodes. There is no way that any surgeon can anticipate how many lymph nodes exactly are going to be removed, because every patient is different and physiology, anatomy, and the lymphatic circulation is just simply different. The number of lymph nodes basically will be able to tell you how many lymph nodes were removed once the surgery is done. So we cannot anticipate that number.